to my podcast, Lips of Steel, unscripted, unfiltered, and unstoppable. And today we're taking another deep dive into some health stuff relating to women. And we're going to be speaking with an integrative physician. She's a good friend of mine, Katrina Babcock. And we have known each other since our daughters were pretty little. They were kindergarten age, I believe.
Yeah, preschool.
And she has a very interesting practice in that she doesn't work with patients in the same way. Like if you go to your regular primary care physician, she uses what's called an integrative approach and also a little bit of functional medicine. And there's welcome and thank you so much for being here.
Thank you.
This is so exciting. It's so fun to see you again.
I know. It's nice seeing you too.
It's been a long time.
It has been a while.
So let's just start off with what is your background?
Okay, I'll give you a little history about me. I am an osteopathic physician. First and foremost, I was a chemistry major.
Okay.
I have a master's degree in physical chemistry. And then I went into physical medicine. So that is my specialty.
So you did a change in career.
Yes.
I did. See, I've known you for how long and I did not know that. That's very interesting.
I was a chemist and then I became...
When you say an osteopathic doctor, you will people will see when they are looking at physicians, you have MDs, medical doctor,
yes,
and then DOs, Doctor of Osteopathy. So they're a lot of people don't understand the difference between the two.
Yeah,
and
okay,
there really isn't as far as their training. I mean, well, no, I'm sorry, there is difference in their training, but they both take the same medical exam.
Exactly.
So. Tell me what's special about a DO.
Well, I always like to say there are two types of physicians. I mean, there are tons of doctors, of course. Right? And you can be anything, be a doctor of something. But two types of physicians, and they're allopathic physicians. They get an MD degree, right? An osteopathic physician, and they get a DO degree.
Okay.
And the only difference is that I think that the best way to put it is that as an osteopath, you're already trained into doing integrative medicine. You always look at the whole person,
right? And
you can evaluate, and you always look at their musculoskeletal and compare it to something that may be organic, like, you got right upper quadrant pain. It could be gallbladder or it could be a rib out. So that's what we're trained.
Got it. And so I mentioned to you before we started filming today is that I have always used DOs. And it was not like I set out to only use DOs. It just has happened that way. So my primary care physician was a DO, and even Alexander's pediatrician was a DO. And it just, I love the approach.
Yes.
Which is interesting because I'm a registered nurse, and a lot of people think that because you're a nurse that maybe you are singular focus in how you would practice, but I'm very holistic, and I really like to take a non-medical approach when I can.
Sure.
And look at the whole person and look at what the body is capable of doing.
Absolutely.
So, yeah, kind of interesting that it kind of all naturally came to be.
Absolutely.
So, and it's, again, super cool to find out that you're a DO because...
thank you.
Now I know why I like you even more.
Yes. I know. It sounds like you just have an affinity to that type of medicine anyway. And you can just, sometimes that's it. You're just attracted.
Yeah. And my specialty was maternal child health. So women and babies. And I worked labor and delivery and did all that kind of stuff, which is great because for the most part, the birthing process is not pathological, or it shouldn't be.
Right.
Unfortunately,
it can come.
It has become that in the hospital system. So one of the reasons I'm not working in the hospital anymore, because it just doesn't align with me. So integrative medicine is absolutely something I'm super fascinated with, and I've been talking to a lot of people. I brought several guests in here that approach the idea of integrative or functional medicine, and I just want to keep peeling back the layers and get more and more information. I feel like people need to hear this information, that there is another way. We don't just have to be throwing pharmaceuticals at people as the only way to for a path to wellness.
Exactly.
Which brings up your website. It's in your the name of your company.
Yes.
Which is
the Center Wellness Center for Healing.
Okay. Wellness. So you have wellness in your title.
Yes.
Which is an amazing, way to approach it, because most medicine, we're just dealing with symptoms and sickness. And you're saying, let's get to you before
Exactly.
you get to the point of sick, it seems like.
Well, yes, that's exactly what I'm trying to create. But, honestly, usually I'm at the end of the line. They've gone to everyone else by the time they come to me. So, yeah, that's part of the problem. So at that point, you are in more of a defensive mode instead of, being prophylactic and treating the person and telling them this is what we need to take care of now to get to the next level.
For optimal health.
For optimal health.
And that's actually interesting to hear that. But when I look at what I read on social media and what I hear amongst my peers, that is kind of true. And the one thing that we're really going to talk about is menopause. But
yeah,
that they're dealing with symptoms, and another thing is PCOS.
Yes.
And I've got a daughter that has PCOS, and we've gone through the mill with that. And it was, really more of an integrative approach that finally diagnosed her properly and got her the right treatment. So,
yes. I guess just on a side note, one thing I wanted to say about integrative medicine is that it also gives the patient more of an option. You really are partnering with your physician.
Okay.
You're really, I might say, give you options that supplement something more holistic. Go to acupuncture or here are some Western medications that will also align with this problem. So you still have, Western plus more of a alternative, complementary, like a medicine type of.
Which is, to me, is great. I never want to ignore what we categorize as Western medicine, because there are some really good things out there. There's been life-saving things, life-altering things. But the thing is about balance.
It is
balance. Creating the balance between the two.
Yes.
So that, we're nurturing the wellness and the optimal health, at the same time, of course, dealing with symptoms that may come up when the body is not in alignment and not in health.
Absolutely. And that's why I feel that most people, like I said, they're procrastinating. They've gotten to me at the last minute. the 25th hour. Right. But now they're in a hurry to get well. So a lot of times when it's a chronic problem and you realize that probably the best way to show them the path to health and wellness may be to do something Western medicine. It just acts quicker, and then you can then start pulling back the layers from there. If someone, for example, I have so many patients and pain, people are in pain.
And you used to have a pain clinic, if I remember correctly.
Yes. I had a pain clinic in West Hollywood. And still I was doing more integrated medicine. We did IVs. Even 10 years ago, I was doing peptides and all types of injections. Yeah.
Ahead of your time, lady.
Ahead of my time. Absolutely. But, it's, and maybe that's the type of patient I'm attracting, that they do want to go a more integrated route. But now, it's 5 years where they've been uncomfortable and gone from physician to physician and not gotten any answers, and, basically saying, this is how you're going to be. And when they get to a place where they're, I don't want to say desperate, but, they're in the line.
Yeah. They're exhausted.
They're exhausted. Yeah. So you have to kind of, show something like, hey, you're going to get better. We're going to improve, but this is where we're going to go here, but we're going to have to come back from there and then find out what got you here and try to get that. Yeah.
Right. You have to, like from a medical perspective, it's like you calm the inflammation.
Yeah.
Then you treat the reason.
Absolutely.
You get there. So
Absolutely.
That makes sense. So what do you think the most important elements of integrative medicine are?
I think the most important is that, you do know there are other pathways and options for the patient. You're able to relay that to them, that this is not a straight road.
Right.
There are 4 or 5 ways to get to a road of optimization. And we the patient and the physician will have that opportunity to share that route together and decide together.
Right.
So that's, I think that's the most important thing. The patient has more control over how they heal.
Right. Sounds like some self-advocacy going on.
Oh, yes, absolutely.
Yeah. Which, I mean, and I almost feel like people need to be trained into that. I talk to people all the time, you know, as a healthcare provider, healthcare professional, how do you advocate for yourself in a healthcare setting? Because they don't know.
No.
They don't know that they can ask questions. They don't know that they can not just ask questions, but question a treatment plan and say, let's dial this back here, slow down there, you know, Dr. So-and-so. And before you start throwing all this stuff at me, talk to me about what this is doing. And not only that, but the system, the hospital system or not just hospital, the medical system, and being able to, so participating in your own care is so empowering, and feeling like you are contributing to your healing to me, seems like a very, very strong part of the healing process.
Absolutely. I mean, your words are gold. They are exactly what the patient needs to hear. We are trained in passivity, and we're trained to listen to the authority, which is the physician.
Right.
The physician also, time limit is very, very short.
Right.
So they're creating a scenario where they're going to tell you all the information. You really don't have much time to have an input and ask questions and get to the route where you go without. And plus, at the end of the appointment, the physician also wants to have not just listen, but do something. So now they may be giving you medication you may or may not even need, because they don't really have the whole story either.
And that's because you're talking about a more traditional approach.
More traditional approach.
And you see that all the time. Like you know, just talk to the schedulers when you're scheduling an appointment, and they have a 15-minute window. That's it.
And that's because, and that's where I'm going to just throw this in. And that's where functional medicine, integrative medicine, and traditional medicine all differ, because most traditional practices, they want to take your insurance.
Yeah.
I mean, and honestly, they literally cannot afford to, if they're just taking insurance, to just do more than 15 minutes.
Yeah.
They cannot even, afford office space.
I actually had it one time I went in, and I think it was actually with my daughter.
Mm-hmm.
And we had seen another doctor other than, the one that we normally saw. That actually she's a friend and all that. She's amazing. So I said, we got that, and we had like a laundry list.
Mm-hmm.
And because there was just so many different things that were going on with her. And she said, I can't do that. I mean, that you have like 5 or 6 things. I can only do 2 today. I'm like, but we have all 5 of these things that we need to address, or 6 of these things that we need to address. And it was very aggressive. It was like, no, we don't have time for that. It's like, okay, so can I please schedule 2 or 3 time slots, please? And let's get this taken care of.
Mm-hmm.
And I was like, that was so disheartening.
It is.
And she was much younger at the time, but it was very disheartening. And our, kind of shines a light on what a mess our medical system is in.
Healthcare is heartbreaking. It really is.
It is.
And even me personally, I'm in a situation where I really want to help the patient. And I do. I go over time. I'm not getting paid. I want them to be able to use the insurance on something. So I do have a hybrid practice where, you can come in. I can evaluate you to a certain extent with your insurance. However, there are other things you can pay cash for so that you can still get me.
Yeah.
But, realize that there are other things you can pay cash for, and then we can still get to the bottom of the problem. I try to do serial appointments that I can, if I don't have time, 30 minutes, I can at least see you again, even within the week, and 30 more minutes. For follow-ups, to get the whole story. And they realize that too, because I want to continue to take insurance, and it's not doable if you, not good for the patient, not good for the doctor.
Right. So you said that you had a pain clinic previously, and I mean, how was, did you utilize the whole integrative medicine approach there, or have you shifted more into integrative?
No. Okay. I utilized an integrative approach there too.
Okay.
I always have, just because even intuitively, I didn't want people on a lot of narcotics. I definitely didn't want to be a person that, I have to see her every month and just to get narcotics from. And I didn't want them to be on that, basically be a slave to medication.
Because pain, I'm just going to jump back into my, the evolution of my nursing career.
Sure.
Pain has shifted tremendously in the healthcare system. When I first started in the early 90s, we weren't given a lot of pain medication.
Right.
Patients were in pain, and that was really affecting their overall health. It was affecting their healing and their recovery times and all of that. Then the pendulum started to swing.
Sure.
And in the 2000s-ish, we were told as nurses that pain is whatever the patient says it is. So, you have your pain scale. 0 is no, this is how I used to tell my patients or, instruct my patients. What is your pain on a scale of 0 to 10? 0 is no pain at all. 10 is being thrown off a 10-story building and hit by a bus. It's like, to give them perspective. It sounds like a huge range. It is. It's a very huge range.
Mm-hmm.
And I'll never forget having a patient sitting there filing her nail. She goes, my pain's a 10. And I'm like, let me explain that to you one more time. 0 is no pain. 10 is the 10-story building and hit by a bus. My pain is 10. Can I have my pain medicine now? I'm like, okay then. And there you go.
Yes.
And we wonder why we have a opioid crisis in America.
Yeah.
So now the pendulum is again swinging, and we're we're looking at pain again, evaluating it differently and medicating it. We're not as generous with the narcotics, which is good.
Well, that part is good, but then at that point, it's always two-pronged.
Right.
It's good that we're not using so many narcotics, but there are people who need narcotics,
right,
that do not get them.
Mm.
And because pain is subjective.
Yes, it is. Yeah.
It is subjective. You can't
be filing your nails after being hit by a bus. Just saying.
Yeah, just saying. Just saying, you can't.
I don't know about that.
Yeah, but overall, and you do have to take that into consideration. Also, pain, how people act with pain is different too. So I may be right now have a pain scale of 8 out of 10, but you would never know it because I'm not. My back is hurting. Oh, right, girl, I'm okay. I don't. Right. And there's a
cultural. My experience has been there's actually cultural differences,
expectations too.
Yeah,
of how you're going to create,
how you're going to express pain, mm-hmm. and I've had patients that you could tell. I knew intuitively,
yes,
but their expressions were like, ooh.
Mm-hmm.
They barely squeak.
Yes.
Because they learn to internalize it.
Exactly.
It's a very different approach.
It is a very different approach. And you have to realize as a healthcare professional that you can see the whole person from there. And then that tells you something about their overall, how they're reacting to pretty much everything in their lives.
Right. Yeah, pain's a good indicator of a lot.
It really is. And while
a lot of coping mechanisms.
And that's why functional medicine is so important. That it does get to the root of that.
Yes. And, pain is probably one of the, I would say, one of the most prevalent things that people go to a physician for.
Mm-hmm.
It usually takes something like that before somebody, which is not good because they leave a lot of other symptoms unaddressed, which means that by the time you're in pain, you got a whole slew of things going on behind the scenes.
Absolutely. And then once again, we're back to functional medicine.
Great.
Yes. Why are you procrastinating so much with this problem? And then some people, I've had people right here. This is, at night, I can feel it. Well, how long does that last? 5 to 10 minutes. What am I going to do about that?
So then you say, what else is going on here? Right.
Yeah, but they're micro-modifying every aspect of every ache or pain, or
Right.
I mean, some hypochondria there, but that's another thing.
That's a whole nother thing.
That's a whole nother thing.
So let's talk about what, for your practice and what you're doing, what is the most common things women in their, because our target audience is 40s to 60s-ish, we have probably some people younger, some people older, but that's kind of our target. What do they come to you for? What are the top things that women specifically come to you?
Number one, fatigue. Everyone's tired.
Oh,
yeah.
Excuse me while I take a nap.
Right.
Everyone, they're just thinking it's nap time. It might be nap time. Okay.
And with that, fatigue and insomnia. So I get a lot of insomnia too.
So they do go hand in hand.
They not necessarily.
Like if you have insomnia, you're up all night for whatever reason.
Yes.
Which I could talk to you about that. Like last night at 3:30 in the morning, and I'm like, okay, now why am I awake? And then that happens often too. I'm like, okay, now I can sleep, and I want to sleep for an hour, get a good solid, Yeah. Anyway, so fatigue and insomnia.
Yeah.
Tell me what that's about.
So usually by the time the patient gets to me, and you really do have to do an extensive history of what is going on.
Okay.
So the history usually in body language, you're looking at the patient, it tells you 75% of the story.
Got it.
And then by the time, you get through the history and they trust you, and then they tell you a few more things that, and I was taking this medication and I was drinking coffee till 12 o'clock. And just other different things. Or my kid just went off to college. Or my kid hasn't been in the house. I'm angry at my whole family. Whatever. Right. They tell you that if you sit there and just listen. And a lot of times, they never mention pain. However, when I do the physical exam, I find so many limitations in mobility.
Oh, okay.
And then when I actually palpate them and touch them, they're like, ooh, they're not even aware of what's going on with their body. A lot of people have that separation. They have a really definitive line between reality of what's really actually going on. Oh, I'm really flexible. Well, can you move your neck?
Oh, right.
So, and maybe they can, bring their knee to their chest, but they can't turn around and see if the car is passing to the right.
Right. So you mentioned, one of the things that you said is you were kind of describing some of the background stuff is that their kids may be going off to college. And what that brought up for me was the women that I'm talking about, these 40s to 60s, have been parenting.
Yes.
For a good portion of that, for maybe 20, maybe 30 years. And they have set aside their own needs, most of them, I would say.
Yes.
And the aches, the pains, the stiffness in the neck, the shoulder, whatever it is, they've set that aside. And I'm wondering if, hey, your kids are becoming independent. They're in high school. They're driving themselves now. Or they're off to college and you're, empty nesting it like you and I are.
Yes.
And all of a sudden, I don't have other needs to take care of. So
now I'm aware.
Yeah. My stuff.
Yeah.
How often do you see that happening?
Yeah. Okay, that's ironic. That you're absolutely right. People like us, we do. We're just skipping along until our kids are out of the house and they're like, oh, wait a minute. This shoulder has been bothering me for a while. You know what I mean? And like, I guess I'm going to, you do all your little stuff, your Bengay or whatever they're using these days, swallow pass.
Yeah.
And, but then you go to the doctor and then you realize the shoulder is just the tip of the iceberg because your lower back has been going out for the past 5 years and, you can't bend over or whatever. But yes, I see that probably 50 to 60% of the time. And then there are other people just like us, kids been out of the house. I wouldn't have even known they had kids. They're just...
They're like, bye.
If I hadn't done
on with my life.
Right. Yeah, if I hadn't done the history that, and usually I'm trying to guess. A person, that's my superpower.
Oh.
Well, a person walking the door And regardless of what they're going to complain about, I always look at how they're walking, and I'm like, oh, okay, their back is out, their shoulder, they have a hurt hip. Oh, ooh, they can't move their nipple. They're not swinging their arms. I see so many things, and sometimes it's like, I don't want to see all this.
Yeah.
You know what I mean?
I have a friend that does MFR.
Yes.
Okay. And she's always doing that. She's like, we're walking. She goes, that person has pain in their left foot and this and this and this. I'm like you, like a psychic medium, but for the
body.
For the body.
Yes.
It's hysterical to listen to. Because, I mean, but it tells you a lot. I mean, interestingly, I've actually watched myself, you know, all the Ring cameras and stuff.
Yes.
So I've watched myself get up and walk, and I'm like, oh, girl. Oh, girl. You gotta do better, because this leaning forward thing and this weird everything I'm doing.
Yes.
Not good. Take care of that stuff.
No. I mean, but thank God we don't live in America, because if we did, that would be a problem. I wouldn't want to see it.
Yeah, exactly.
I'll be like the horses with the blinders on.
So fatigue and insomnia, what is your approach to that? Like, what is it? You're talking a little bit like, you know, the history, coffee and all that other stuff.
Mm-hmm.
Then what? You know, once you've uncovered all this stuff, then what do you do?
Well, usually, I mean, it does come down to, I mean, most of the time it comes down to what they are putting in their bodies.
Okay.
I mean, and not necessarily even coffee or tea. I mean, a lot of times it's caffeine, but, you know, drinking 3 glasses of wine at night and, I get to sleep, but I wake up an hour. You know, alcohol-induced insomnia. Oh, okay, you should have told me that.
That's right. I had 2 cocktails last night. There you go.
And there you go. And that's what, yes.
Thank you. Here, just send me your bill.
Yes.
Cocktails will do it.
Yeah.
Okay.
So, I mean, really, honestly, the history tells you so much.
Which is like, I hate to say this, but that's kind of a bummer to make that correlation. I have heard this before, but I am an empty nester now. I am, like, after 40 years of parenting nonstop, I am finally at a place where I can do what I want when I want.
Yes.
I can go out and go hang out with my girlfriends.
Yes.
And I don't have to worry about being home to pick up a child from dance or, you know, get them from sports or whatever other activities, help them with their homework, cook a dinner.
Yes.
It doesn't matter. Nobody's waiting for me at home but my dog and my cats.
Right.
You know? So I can have a good time at it. Damn it.
Can.
That sucks. But now I have to deal with it. So it's like, you know, which one do you want? The insomnia or the cocktails?
The cocktails.
I vote cocktails. Absolutely. Okay. Well, so I'm gonna jump right into because I don't want to run out of time.
Okay, let's get there.
Let's talk about menopause.
Yeah.
I mean, there just absolutely everybody is talking about this right now.
Yeah.
I will tell you, I was lucky. I was 51.
Okay.
And all of a sudden I was like, well, I guess this is it. You know, no hot flashes, none of the symptoms that anybody else had described. I was younger than the other women in my family, which was interesting, probably related to going through IVF. I don't know.
Yes.
But it was like, now it's here and now it's not. And I was, I didn't even have a perimenopause that I know of, that I recognize. And then boom, I was there. So I'm very lucky. I know that. I feel very grateful that I, went through it so quickly and easily, but that is not the case for most women.
That is not the case for most women. And most women do. They go through a perimenopause or a premenopause type of scenario.
Right.
One, they feel like they're not themselves. And the problem is that, a little more grumpier than usual, intolerant, like you see you know what they're going to ask you and you're already upset about. Like
okay, you're messy.
Yes. But but you're still getting a regular period. And then a little more insomnia. Usually with that, you probably have seen OBGYNs or gynecologists. When the patient is at that scenario, they're usually progesterone depleted, or at least it's going down. And so
not estrogen. Okay.
Yeah. With the sleep, more irritability and,
and the progesterone's the feel good.
It is.
Hormone.
It is. I feel good. So usually, I can and it's one of those, or, you know, a little more, I'm not going to say it's benign, but a little more benign than estrogen. I usually never, ever use estrogen without using progesterone.
Right.
So,
but you can use progesterone
without estrogen.
Okay. So even as a nurse, I mean, I don't do postmenopausal or menopausal stuff. That wasn't my thing. I was about delivering babies, right? And I had a friend tell me that her doctor prescribed just progesterone. I'm like, I thought they had to go together. Mm-hmm. Did a little research.
Yeah.
Yes. So kind of an interesting phenomenon that the progesterone is okay alone.
But estrogen, you can't, you don't want it unopposed. So, yep, exactly. So that's usually where I start.
And those are commonly referred to as HRTs.
Yeah.
Hormone replacement therapy.
Yes.
Okay.
Yes.
So you feel that is a good starting place when someone is just starting to go through like the PMSy stuff.
Yeah.
Hormone.
And honestly, I always look at the thyroid, and I always look at vitamin D, because those two hormones can also contribute to some of that same type of scenario.
Right.
I mean, there are so many things really that can present that way, you know, other than just what's going on in your environmental, you know, that's internal.
So you say vitamin D, and I've actually recently heard of it referred to as a hormone. How often do you see vitamin D deficiencies in people?
95%. No, I'm kidding. I'm exaggerating. But it's very high. 85 to 90%.
People are inside so much and working jobs inside and not just, you know, spending their 9 to 5.
I'm sure that's a lot. It has a lot to do with it. But plus, they're not getting it in Whole Foods. They're not getting it, you know, dietary at all. Also, you know, the darker your skin, actually is more difficult for you to metabolize it into vitamin D. You would think it's the opposite, because, you know.
But the melanin is there as a protection.
Yes.
And it's like...
help absorb
it's like if you put like, what do you call those on your windows?
A tint.
Tinting on your windows.
Right. Yeah.
Okay.
So you can absorb the sun, but not assimilate it maybe to create what you need, which is vitamin D.
Okay.
What was your question?
We're talking about vitamin D being a hormone.
Yes. So and I see it often, and I usually personally, I put people on something that I think they can be compliant with, and that's 50,000 I use weekly, 1 pill weekly.
Oh,
yeah. That's right.
Oh, okay.
And so usually on Sunday you can pop one in, or Monday, whatever day you decide, of course. And probably about 3 months, you're where you need to be. The thing is, when you're doing labs, they always put that at 30, that's your, you know, optimal. You're not optimal. You're just over the limit of not being insufficient. Okay. You're insufficient up to 29. So if you're 30, how is that optimal? Yes, not. So most of the time, I like for my patient to be at least 60 or 70. I mean, of course, you can have the toxicity with over 100, but you do want them higher than 30. Okay. I mean, you don't have a net. You don't have anywhere to fall.
Yeah. If you're at the low end of what they call normal.
Yeah.
Right. Yeah. And you very quickly could dip into. I had another guest here who was a chemist, and we did a whole slew of labs for me.
Okay.
And it was all the things that she would do to look at. She did more athletic performance, optimization, and stuff like that. So I looked at my labs from what was normal, what a physician would say, yeah, you're fine. Mm-hmm. And she looked at it from a different perspective, and her ratios and margins were very, very, very different. And so we talked about that, and it makes sense. Mm-hmm. But then we also there were some other things we discovered, because she really dug deep into the labs, and my iron saturation, iron, ferritin were all out of whack. Mm-hmm. And she's like, So now, you know, we're looking at the possibility of hemochromatosis.
Oh, yeah.
But nobody would have no doctor would have looked at that. My doctor that ordered the labs, oh, this is good. This is good. This is good. You're fine.
Yes.
That was it. Boom.
Yes.
You're fine.
Mm-hmm.
And, but that, I mean, it's not like it's a common thing, but I do have Mediterranean ancestry. Exactly. So there's all kinds of weird little blood, anemia type things that go on in the Greek.
Yes, it is.
Thalassemia. Yeah, thalassemia
yes.
of several different kinds. Mm-hmm. And my family does have that. Mm-hmm. So without looking at it from a functional or integrative approach, they would just let me go and go and go. And the damages that cause your body when you don't really dig deep and look beyond the norms.
Exactly. And I call that, you're practicing as Dr. Quest or Dr. LabCorp, wherever you get your labs, or whatever they tell you is normal, that's what you're going with. And you're not even looking at the patient. Right. So every patient is an individual, customized. Right. So, I mean, even though I may do great if my vitamin D is 30, I may do, but you may not be, it may not be optimal for you, but it may be optimal for me.
Right.
So you may really do need to get it up to 60, and then you're like, oh, I feel so good, I think that, or whatever. Even thyroid. And that's one of those things too, for fatigue, that I always look at. And I mean, come back normal. I mean, even the labs is so interesting to me that if you go and you look at the labs and it's like, okay, the norm is 0.5 to 4.5. And then they have a little note under it. The Academy of Endocrinologists feel that if your thyroid stimulating hormone is over 2.5, you have hypothyroidism.
No.
But the lab normals are up to 4.5.
Oh, interesting.
So you really need to look at that,
right?
Closely, and you need to look at everything. Like, okay, it's 3.1, but you still, it's still low. Your T3, T4, whatever. So I'm just saying that each patient is definitely. I mean, even if you're not a functional medicine doctor or integrative medicine doctor, you should still realize that my genetics, my DNA, it's not the same as yours, and I may not respond to things that you will respond to. So therefore, be very aware of the customization of each and every patient.
But in the traditional medicine approach, they don't have the time. 15 minutes is not enough, and they're not going back to their desks. So they're reviewing labs and going, let me look into this further, You know
what? I think that they don't have the time, and they do have the time. They don't take the time they have to create the scenario. Yeah. I mean, it's easy. I mean, even if I have 15 minutes with you, if you come in and you say, Katrina, hey, my back and shoulder, in that 15 minutes, I can still treat you like you're Nicole. You know what I mean? You're not like woman A. So, right. And try to get to the bottom of what I can in those 15 minutes. And then at the end of that 15 minutes, I do have something very particular and very specific to tell you about your problem. And you might need to do a little more homework when you go home so you can come back to me a little more educated about what I'm trying to do, and then you and I work together. Right. So, I mean, I think that, granted, if you're working in a big company as a physician and you have a quota, I mean, you're just trying to get through the day. Yeah. I mean, but apparently that is the route you've taken and the route you decided to go. Right. So,
which is why someone with your approach can be of tremendous value. So to the whole process. So we talked about HRTs. Let's get back to menopause.
Okay.
We talked about HRTs to support the early stages of perimenopause or premenopause symptoms. Now let's move into where people are like full-blown menopause symptoms. What are some of the biggest symptoms that, besides fatigue and insomnia, I guess? Well, those are two that I hear about all the time.
Well, the big one, hot flashes.
Yes.
I mean, I went through hot flashes personally, and it is just embarrassing. It is a mess.
Yeah.
So definitely when you start feeling that, you really don't know what's going on. You assume that everyone is hot. We live in California, so, I mean, we do have that to fall back on
Right.
12 months a year. But hot flashes, night sweats, which also leads to insomnia too.
Right.
So those are the other two. And those are definitely estrogen driven.
What causes the hot flashes? That's something nobody ever talks
Oh my
about.
goodness, I don't know.
Why? That's the big why question. Is it just a sudden shift in the hormone?
In pituitary.
In the pituitary.
Yeah, I'm sure the depletion. Yes.
Okay. So like nobody ever talks about why they happen. They just like, oh my God, I'm having hot flashes, and suddenly they're taking their jacket off and their face is red and they suddenly are covered in sweat. And it's like, I always want to know why. That's my big question. Why? Why is that happening? Like,
well,
we can treat the why. So why?
Yeah, definitely. But I mean, it definitely is happening in your brain, and it's that loop. Your ovarian to, hypothalamus, your pituitary going to the hypothalamus.
Right.
That whole loop is getting cut off because the hormone that's regulating that has stopped being created in the place that it is created, which is the ovaries.
Right. So
that's the problem.
So that really sounds like the HRTs, why they're so important.
They are very important. I mean, that's just like, the trainings. I'm putting coal in, but I've run out of coal.
Right.
Now, what am I going to do? Oh, I'm just going to...
Yeah, keep that train going.
Keep the train going. We got to go find some coal,
right?
To just feed the... Yeah, exactly. Feed the beast.
Right.
That's us.
And, because I've talked to different doctors. I tried HRTs for a very brief period of time because my real only symptom that I had was hip pain and joint pain.
Mm-hmm.
I called it the roving joint pain. It would sometimes be in my knee, then it would be in my elbow, then it would be in my shoulder, and it would, it would just kind of move around. Now it's found a home in my hip. My hip, it's like, oh, for God's sakes, I got bursitis in my hips, but it's not. I don't think that's really what it is. It's just this constant hip pain. So I tried HRTs for a while, and it helped a little bit, but then, I wasn't really sure about, like, if I didn't have a ton of symptoms, they say probably you don't need HRTs. What do you think about that?
I think that there's so many studies coming down the pipeline. You want to look at once again, the whole patient,
Right.
I mean, do we really need, even if it's just a small amount of hormones cardiovascularly or for your heart and, just your internal organs. So, that's a good question. I'll get back with you on that. I think that
sounds like it's an individualized question.
It is. Symptomatology does kind of lead the way for treatment. And, but sometimes if you're looking a little closer to the patient, even if they don't have the symptoms of, their symptoms may be abnormal. Not abnormal, but they may be different than the most seen,
like the
symptoms. Yeah, the symptoms that most people have.
Okay.
So you have to realize that, once again, we're dealing with an individual, and see, well, like whoever your physician gave you the HRT, then you're, monitored, this is helping. Maybe not that much, but, enough to keep you on it for a couple of weeks and then decide if it's a difference.
Yeah.
So it is individual. Yeah.
Okay. What are the other things besides HRTs do you like to use to support menopause symptoms?
Of course, exercise. I like to review what you're eating. You want to keep your inflammation down, definitely. And bottom line, if you can get your diet in check, and even so, let me start over. I always want to make sure you're sleeping okay. I want to make sure your nutrition is at least 80-20. And I hope you're eliminating and looking at your elimination, that you're getting out the toxins.
Okay.
So, and then at that point, exercise is my next one. So those are my 4 where I want everybody to kind of have that in mind.
Okay. It sounds like the basics.
It is the basics.
Basics of wellness is rest, nutrition,
elimination,
exercise.
That's it. Yeah.
And hydration.
And hydration.
Yeah.
Which is part of nutrition.
I have this everywhere I go. Always have it. I like cold water. So, as a matter of fact, it's been a little bit jealous much. No. No, I drink tons of water. And, I think that more and more people are realizing that hydration is a big, big, big deal.
It's huge. Exactly. Yeah. I always drink probably a liter and a half in the morning before I go to work.
But when you bring up nutrition, it brings up the food is medicine.
Which is, basically the foundation of functional medicine. Food is medicine. I mean, it's basically where you start,
right,
with functional medicine.
And we're hearing a lot more about that. And, the people are starting to pay attention to the fact that we've not done a great job in the United States with our food supply, with the
GMOs.
GMOs and the food colorings and the dyes and the just the whole preservative things and the manufactured food.
Yes.
You look at the foods here and the foods in Europe, and I look at I've traveled extensively, and I can spend 2 weeks in Greece and come back 6-8 pounds lighter. Of course, I'm walking a lot. That makes a big difference, but the food I'm eating is just whole, no processed food. It is just all good stuff that came either right from the ocean or right from their pastures or from the gardens. It's just all really good, healthy food. All over Europe, the same thing.
Yep.
Even in the Middle East, I've traveled through there. Everything there's nothing processed. You can go into a grocery store and you can find some box things, but they're usually ingredients that go to, something else that you prepare. There's just such a difference in what we do here. We're just all about quick, convenient, fast, simple.
Exactly. Yeah. And here it is a little more difficult to find that food, the nutrient-rich foods. If you go to the farmer's market or Whole Foods, they act like it's a luxury to have, nutrient-rich foods.
Right.
You can get food anywhere, but it may not have what you need. The potassium, phosphorus or potassium may not be in your potato. Who knows?
Right.
Our getting
soils are so depleted.
It is depleted.
I actually do canning. I like to do food preserving and stuff like that. And this is going to sound strange, but there has been such a shift in the United States as a whole that when you can tomatoes, you actually have to add a lot more lemon juice to it to bring the acidity up. Now, we've always thought of tomatoes as a high acid food,
right?
But the acidity in tomatoes has dropped so significantly that in order to safely preserve them, because when you can something, you're preserving it for a shelf life of up to 2 years. So I make tomato sauces and tomato soups or, different things like that.
Yeah.
I love doing that. But you have to, so the USDA has this whole protocol on canning and food preserving for safe, you don't want to end up with botulism and stuff like that. Botulism amongst your friends.
Right.
So you have to actually add things, which a lemon is fine, lemon juice is fine, but to bring the acidity up so that it is
so interesting,
shelf stable. So they're seeing that the nutrient value in produce has dropped because we just have depleted our soils so terribly.
So terribly. I have a garden actually. Yeah. So I have tons of tomatoes and tons of zucchini. My zucchini are this big. What can you do? You go in one night, you come back out and it's this big, and what are you going to do with that? It's like...
It is just a little creepy how they grow so fast.
Overnight.
Yeah. I've had that too. I've got, I'm like, oh, that's kind of, no, I'll wait till tomorrow. And it's like,
yes.
Holy smokes.
Exactly.
We love zucchini. We like to make zucchini lasagna. Oh. That's one of our favorite. We slice it really thin, layer it, use that as the noodles.
Yes.
And then the sauce and the cheese, all of that.
Yeah, that sounds delicious.
It's good. Or you can even just add it with, even if you want noodles in it too, but adds a little bit more of a vegetable to the
some nutrients to it too.
Zucchini roll. Or make those instead of cannoli or cannelloni, I think they call it, where you roll the noodle.
Okay. Yeah. The That's what it's called.
Yeah.
Canola.
No. Cannolis are the sweet ones.
They're called, I can't, why are you,
Where are we talking about cooking? Well, because, food is medicine.
Food is medicine. Yeah. Yes. I'll have to get back with you what those are called, though.
Yeah. Whereas my Italianos. Okay, what are we not talking about with menopause? What do you think we're not talking about? Because I was getting hungry, so I had to get off the food subject.
I think we are. I mean, I think we're not talking as a community because there are so many avenues that we can go down that can help different people. But because we don't have a community about we're all going to go through menopause, and that we're all having different scenarios that I may have had something different, but oh, yeah, my friend or my friend's friend had that same thing. And what did you do? And what worked? And what doctor did you go to? So we're not having, that's what we're not doing. We're not having a really community and women saying that, okay, we all need to kind of do what men have done all the time about our health and theirs too, which has been wrong about our health. But, but yeah, that we should have a community about what we should do and realize that there are so many avenues and some people are going to do better with HRTs than but other people just need to even optimize other things in their body, like their thyroid or their adrenals or those things that are out of whack, even though everything else, even though they are depleted of progesterone and estrogen and testosterone.
Oh, yeah, testosterone. Didn't talk about testosterone.
We didn't.
So,
yeah, we love testosterone.
Okay, my cousin affectionately calls them butt pellets. So she does the butt pellets every 3 months or something like that, and she's telling me about how great they are and how they, she feel. And I have not tried that yet. I don't know. I'm a little nervous about it.
I mean, they're great. They really are, and the reason is because even if you're doing. So one thing you should realize, I mean, this is what I was always taught, and people don't go by that it's better to get estrogen transdermal, so creams and patches.
Right.
And for progesterone, the pill is absorbed better, but, with progesterone, you have to do it daily. With the patches, or if you're doing the cream, that's daily. If it's the patches, that's twice a week. When you're doing the pellets, I mean, as long as, and usually what I've seen, they start everybody off with the same amount of pellets. Okay. And so it may not last you 3 months. You may become more symptomatic, but they can at least put estrogen, progesterone, and testosterone in the pellets.
Oh.
Yeah.
What?
Yes.
Oh. Yeah. Okay. So wait a minute. So like what symptoms is the testosterone specifically, like what is it meant for?
Lean muscle mass, libido, just virility, just
overall wellness.
Yeah, feeling good,
Oh, that's gonna be scary.
It can, but you do feel better.
Okay.
Yeah.
So when are you gonna give me some butt pellets?
Come on over. Come on over.
And speaking of butt pellets, gonna use the butt pellet word.
The butt pellet.
That's gonna be our
buzzword.
The buzzword. Butt pellets for everybody. You get butt pellets. You get pellets. We all get butt pellets. All right. You do other therapies in your practice.
I do.
And I was looking at your website. I'm like, okay, ozone, PRP, and different IV therapies.
Okay, I do all of that. And they're all experimental. So, I mean, a lot of times people say that, oh, it's not FDA. Oh, sorry, there were two glasses. It's not FDA approved. It's never going to be FDA approved. If I'm getting your blood, how is the FDA going to approve that?
Yeah.
It can't, it's
I could have a whole episode about FDA approvals. We're just not going to go there today.
Yes, but I'm just saying those, I'm just giving that it's experimental.
Right. Alternative therapy.
Alternative.
Right.
And so, yes.
Which says one thing we got to be clear about. Insurance is not covering it.
Insurance does not cover it.
Right. Okay.
And yes, exactly. So I do ozone. I do ozone intraarticular. I have a ultrasound, musculoskeletal ultrasound. So what I have on my own realized that there is a lot of micro trauma. So I can see micro tears, and ozone works beautiful for that. And so if you're coming in, my shoulder has been hurt.
I go straight to shoulder because menopause and frozen shoulder are also thing.
Yes. Yeah. In carpet, whatever. It just goes on and on.
Yes.
But yeah. But yes, so I do ozone, I do PRP, intra-articular, I do sexual wellness, but not so much for women, but the Mona Lisa, but I do it for more for men.
And that's more for the like vaginal rejuvenation, vaginal tissue.
Yeah.
Okay.
Yes, exactly. And then we were discussing earlier, the one thing, I don't do really any real cosmetic.
Okay.
But I do have this protocol, like if you wanted some unnatural filler, we have a machine that we do draw your blood, get the platelet-rich plasma.
Okay, that's a PRP.
PRP.
Okay.
Heat it in this very special incubator. It makes like a gel, like hyaluronic acid.
Okay.
Inject it like filler.
Oh, okay.
The best part about it is usually it's a little bit overfilled prior, like that day you left.
Feel it swelling.
Yeah.
Right.
But the next day, because it's also integrating into your body, creating more collagen that, it
helps your body produce it. Okay.
And maintain the look you're trying to get. So it's almost like microneedling, but on a higher level. I mean, so yeah. So we do that too.
Okay. Kind of cool stuff.
It's really cool.
And I look at your skin. I mean, no one would ever guess that you were more like 35 years old. You've always looked amazing and beautiful with amazing skin.
Oh, thank you.
Do you use any of these?
You know what? I vet everything.
Okay.
So I have had some of the injections. It's been years ago.
Okay.
Yeah, but definitely. And, I just want to know the procedure I'm utilizing. Is it tolerable? What's really going to happen? I definitely don't want to sell anybody a bed of goods that's not going to pan out,
Right.
Especially, it's expensive. I mean, it's not crazy expensive, but it is expensive.
Right.
And we can do hands too with that. Yeah, definitely. Your hands look good. Don't worry.
They look good right now.
Yes.
They're hydrated. I haven't been out in the sun yet today.
When they stop looking good and you look down and like, oh, lotion is not going to do it. Then you're like, oh, well, maybe I can pop by Katrina's and she can put a little PRP there and plump them up.
Okay. Yeah. There you go.
There you go.
And then the big hot topic right now, everybody seems to be talking about it, is peptides and GLPs.
Yes.
And I love the idea of it. I love the science behind it.
Yes.
So what do you love about peptides and GLPs?
That it is additive. It's something that it's a new tool and it does give really, really good results. And I do have my favorite.
I was just going to ask you that. What's your favorite peptide?
My favorite peptide, because also, I'm physiatrist and musculoskeletal. So I like BPC 157.
Yeah.
And
that.
Yeah.
Okay.
So, I mean, it reacts in your gut. So it helps boost your immune system and it helps with creating a less inflammatory component for your joints and supposedly help repair. All of it, experimental, but I do love it. I get good results.
Where you said it, I heard you say in your gut. Now, aren't most peptides injectables?
They're all injectables, but that's just where the magic happens through this one.
Oh, so it does shift gut health, maybe?
Supposedly. Yeah.
Okay.
It's systemic, so,
That just leads me down a whole rabbit hole. Like when you talk about gut health, there's so many issues, like with children.
Yeah.
ADD, ADHD, and even some of the ASD spectrum stuff. And, they talk about how might gut health impact that. That's a whole nother topic.
That is a huge topic.
Yeah.
I mean, really, from, especially even, mitochondrial injury, huge, especially with kids, with autism and ADHD, all those problems. that may be from the mitochondria, and that's what we're trying to treat.
Right.
And there are some peptides for mitochondrial health. The NAD, which is it's more of a niacin amount. Okay, we'll move on from it. But yeah, NAD is one of them. But also like MOTS, that's one. That's what it's called for mitochondrial.
And why is mitochondrial health and mitochondrial support so important?
Well, mitochondrial is part of your cell,
right?
And cells create long story short, you want your cells to last as long as possible. As long as you're creating more cells, the more younger you look. So if the telomeres are short and your mitochondria are dying off, or you're not creating a healthy mitochondria and your cells are not surviving,
right,
you then become, more osteoporotic. Your skin is more wrinkled. Everything that creates longevity and health is affected. I mean, and that's just externally. Internally too, of course, your brain cells and everything is affected. So that's what mitochondrial health. Mitochondria is the foundation of all your generalized health issues. You can have good mitochondria and have bad health, but
even
not the opposite. You can't have bad mitochondrial and have good health. That's the other thing.
Well, the basis of anybody that's taken a biology class that has studied the cell, the mitochondria is the powerhouse of the cell.
Powerhouse.
It's what generates energy and kind of makes everything else in the cell work. So that makes sense. Bad mitochondrial health means the rest of the cell doesn't work at its optimal level. So why are we not doing this like from a young age? Why are we waiting until we're in our 40s, 50s, and I'll be 60 this year? Why are we waiting so long to support our mitochondria?
Ignorant. We don't know.
Wow, isn't that crazy though?
Yeah.
It seems so simple and it seems just so basic that mitochondria is important, and you're not going to support your mitochondrial health because you've exercised. Well, there's some, yes, there's some biofeedback from that, but you really have to do things to keep that running properly. And I don't know that food is doing it, right?
Well, it does help.
Yep. Yeah.
So absolutely. Okay. Keep inflammation down, making sure those, gateways, sodium, potassium, gateways, all that is working properly in the cell too, also creates a healthier mitochondria.
It sounds like a lot of this stuff also, like when there is injury or disease or whatever, is for supporting the healing process too.
Yeah.
With these peptides sound like they kind of come into play.
Yes.
Or they could come in.
They could come into play, yes. And they're systemic. I know I was actually talking to a patient and they were saying, I have a problem with my knee, and they injected the BP57 near the knee. Yeah. And when they did that, they actually got really good results. But I did tell them it's systemic. It does, start integrating more, in your gut, and then go from there.
And then your whole body.
And your whole body gets it.
So when you say inject it, you're not just sub-Q injecting it.
It is sub-Q.
So it's sub-Q in the general area.
Not necessarily. Usually when I'm instructing patients, this patient took upon himself to inject it near the area that was bothering him, and as long as it was sub-Q and not intra-articular in the joint, I was fine with that. But most of the time, I just tell them find something around the midsection and inject there, and it usually gets to where it needs to be.
And I have what they say, I have really tight IT bands. I'm constantly stretching and doing all the things to, try to loosen that up so that it'll help with, and then, gluteal muscles that are underdeveloped and it's like, have you seen my butt? I've said this before, have you seen it? And I was like, well, yeah, you may have, you have the other adipose that surrounds it, but then the underlying structure that doesn't get, so it causes everything to kind of go out of whack when you're not balancing like the exercise and all of that stuff.
So that's the other thing I look at, and you're absolutely right. I mean, if you have a tight IT band, type hamstring, regardless, you can have it. Your butt may look fine, but it's not firing, so it's still weak. Yeah. So you have to stretch those things out before you can even start doing any exercise to build your glutes.
Yeah.
But that's what I look at. When a person walk in the room, they're like, my right knee, I start from their head, make them do all the range of motions, something, and most of the time they haven't even told me, they can barely, move their shoulder can go 90 degrees. They haven't even told me about that.
Yeah.
And I would never know if I didn't do a thorough evaluation to see what their musculoskeletal system is doing. And it has never failed. If you're coming in with your right knee, that's the least of your worries.
That's encouraging news, right? It's like, thank you, knee, for being the
trigger,
the loud mouth of the body. But we're going to talk about all the things that are sitting quietly in the background.
Exactly.
So, how often do you start people on peptides when they
come in? Well, in my office, we have them do a peptide questionnaire. Okay. So when you come to my office, part of your intake, I do a peptide questionnaire and just more of an introduction that this is some option. This is something you may want to do at some point in your life, but at least you have the exposure. Yeah. And so if they come in, but a lot of people just come and say, hey, I'm interested in being on peptides. And they have like a list. And I want to be on, Semarelin and Apomorelin and blah, 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 blah. Right. And then I'm like, oh, okay, well, what are we trying to accomplish?
Yeah.
And plus it's not.
Oh, that's because they've been on ChatGPT and Reddit. And, they're looking at,
exactly.
Dr. Google.
Exactly, Dr. Google.
And it's like, oh, these look good.
That's my
these toys.
Exactly.
Can you get me these toys? Because these toys look like fun and I want to play with them.
Mm-hmm. Exactly.
Yeah.
That's exactly what happens. And they come in and they tell me what they want. And then I review that, hey, we're getting these from a compound pharmacy. Mm-hmm. So, let's rethink this. And plus you're putting this in your body. And, and you kind of want to know what everything's doing.
Yeah. Well, and you also don't want to overlap or, overdo it.
Yeah. Exactly.
You want your body to still function the way it,
Exactly. And and that's why I'm here to help you make some decisions about your overall peptide needs and just overall generalized nutritional need, micronutrient need, right? Vitamins, NAD, so glutathione. So that's where I come in to help you and I develop a overall health plan for you. And then you tell me in 3 months how you're doing.
So, it's when so funny with the way you create this over, and it just made my head just went straight to like when people, they'll hire a nutritionist or they'll hire a trainer, and that's great, but that only deals with one part of the process.
Exactly.
And people will spend a ton of money on a trainer and a ton of money on a nutritionist, and maybe they'll go to a therapist or whatever, but integrative medicine can bring all those pieces together.
Absolutely.
And we say create that plan, because yes, you can still go out and train, you may, but let's save your money on the trainer. We've got to, this is the kind of training you can do, or, just go out and exercise, whatever it is.
Exactly.
But spend the money on a point person that is going to actually be the head coach.
Exactly.
For the whole process.
And that's it. And just like you were saying, I've been working out with my trainer for 1.5 years and my glutes are still weak. And just like you said, your hip flexors are tight and their hip flexors are still tight. So we're still not getting to the core of the problem. Right. That once you loosen up your hip flexors and your hamstrings, you can walk and start building your glutes. So that's the point. That's what integrative medicine can do. They can help you have a game plan.
I like that.
Yeah.
So Coach Babcock for the win.
For the W.
And then there was something else that you had on your website, and another term was regenerative medicine. And it sounds like kind of all of this is, it's integrative, but you're also dealing with building people back up. When they come to you with the screaming knee, just pulling everything together, getting everything to its optimal health, and being, instead of in a state of dis-ease, which, people don't realize disease, that's what it is, dis-ease, our body is out of alignment, to a place of wellness.
Yes.
And living their best lives. And living as long as they possibly can.
Yes. I mean, and you're absolutely right. When we say regenerative medicine, that's exactly what we mean. To help you repair some problems and continue to at least stabilize any problems that you're having and improve on what you can.
Yeah.
So
I just had a guest last week come in and take a very dear friend of mine, 87 years old. And we talked about dynamic aging, and from a different perspective, not from the medical perspective, but there's just so many things. I mean, that's what I feel like that's what we're looking for. That's what, and because I'm a nurse, I know a lot of my podcast episodes are centering in the health and wellness realm right now, but it's all types. It's mental wellness, it's emotional wellness, it's healing relationships. I want to look at all of that stuff, but it's longevity is great. We want to live longer, but we want to live longer, and we want to live well.
Yes, have some quality of life.
Have the quality of life.
The other thing I was going to tell you, we were talking about menopause. Another thing that women get is anxiety. And they don't realize that it's correlating with their hormonal changes. So they're just thinking that, I mean, you can kind of deal with irritability, but when you have anxiety, it's a whole different type of dynamic on your mind and how you feel. And so that's what, I mean, if nothing else, that's why I really want to tell women right now, if you're feeling just a little bit overwhelmed, I mean, because that's how it presents themselves, it's usually anxiety. Go to your doctor. Try to figure out where you are in your menopausal road. Right. Go to your doctor and be very intentional about what you're feeling. Yeah. And if you've never felt that before, they should realize at that point, something's changing in your body. First big thing changing is your hormones. Right. So let's look at that first. It may be something else that may be, something that all your kids are out and now you're at home by yourself and you have anxiety, but it may be just that.
Okay, but let's talk about that.
Okay.
Because hormones are affected
by your environment.
Because when you have a stressor, whatever, it could be a physical stressor, emotional stressor, psychological, whatever it is, stressors create actions inside your body. It activates our adrenal glands, right? Mm-hmm. And it creates, they start to put out hormones. What is one of the hormones that our adrenals puts out? Cortisol, right?
Mm-hmm. Yes.
So cortisol, what does that do? Cortisol, it stirs everything up in our system, and it's a steroid. It's basically a steroid. It kind of sets everything off, right?
Yes.
So it makes sense that then you have what does that affect with your other hormones, and it throws everything off.
It does. And
so people do not understand that our bodies are made so perfectly.
It is
to work very much in sync. And I'm trying to think of a way to a metaphor for this. But I don't know. Think of it like plate spinning, I guess. Mm-hmm. And you've got all your plates spinning, and they're nice and even. But you have to spin them. You have to go back and tweak them a little bit to keep them going. And then you forget about one. And what does it do? It starts to wobble, right? And so you have to pay, oh, wait, I'm going to go pay more attention. Then this one starts to wobble.
Yes.
So I kind of feel like maybe that is a visual for people to see what happens when things get out of whack.
Exactly.
And when you stop paying attention to one of those spinning plates and they crash to the ground, then what? That's where...
Yes.
Regenerative medicine, that's where you have to really get in and do repair work. But everything affects everything. And women, I think, I could be wrong about this. Maybe I'm just self-referencing here. But women, I think, are more susceptible. We have more hormones in our body that regulate more aspects of our well-being. And we just get too freaking busy taking care of kids, taking care of families, working, taking care of our home and our dogs and our whatever else it is, that we let those, we stop spending, our own, our own internal fight. And
that's the thing. We respond differently too. And our responsibilities are more different than anybody else in the family, including the dad, the husband, the kids.
It just is what it is.
It is what it is.
Yeah.
What I like to say, you said something very interesting, and it's very true. The body is still weird to me. I mean, I'm always fascinated by it because the body thinks that cortisol is the most important hormone. No. So when you're stressed out and your body starts creating cortisol, if you don't have enough DHEA, which is what we really evaluate to see if, you're pretty even out, it takes from everything. That's why your thyroid goes up, your estrogen is off, you may not get your period, you may go in, all those things when you're stressed out. Like, it's because your body is trying to regulate and like, okay, this is not working. Yes. And it will take people come in, cortisol's up, thyroid's all out of whack, blah, blah, blah. I've never had a thyroid problem. Well, are you stressed? Well, yes, my grandpa's in jail. That's yeah. So that's what it creates.
I shared with you, earlier, I've lost a tremendous amount of weight.
Yes.
It was really not about the losing weight, but how the weight how I gained so much weight there was so much stress in my life.
Sure.
And my coping mechanisms were not great.
No.
And I was not healthy. And I'm going back 15 plus years. I feel better today than I think I've felt for the last 20 some odd years. Physically, mentally, emotionally. And I've had crisis. I've lost a husband. I've had all kinds of stuff, and just all the different changes now being an empty nester. I still have stressors in my life, but I deal with them differently.
Yes.
And I think that creates everything, it makes everything kind of a little bit more balanced.
And once again, I think this is why you have this podcast. You want to give women education.
Yes.
You became educated. You're a nurse though.
Right.
But you're educated. And so you realize you can sometimes look internally and realize, okay, I'm stressed out. And the way I protect myself is food. It may not be the best food. And, I've gained this weight, but you know why.
Right.
Underlying, you may not want to address it, but you do know what's going on. We can say that a lot of women, they don't even know what's going on. They're caught off guard. And they're just feeling, like I said, just overwhelmed.
Overwhelmed.
Yeah. And you've always heard about throughout history when hormones are out of balance, all the bad things that can happen.
Right.
So, so it doesn't stop with just childhood, when you're delivering, when you're,
right,
post-pregnancy or pre-pregnancy, postpartum. It's throughout your entire...
through the lifespan.
Adult woman lifespan. Exactly.
Yeah.
That your body is creating different scenarios as it goes forward.
And the only hormones I think women think about are the progesterone, estrogen. They think those are the ones that control everything, but there's so much more.
So much more. And always to look at your testosterone.
Complicated creature.
We're so complicated. Yeah, that's so great.
Yeah,
I know.
But I think, I think to kind of wrap it up here, I could go on forever.
I know. We got fun. I just got comfortable, so yeah.
I know. I did actually. Like we could do more, but we'll have to. Maybe we'll have to come back.
Yeah,
I would love to chat about other things too. But
bring somebody else in here too. Yeah, let's have a round table.
I love round tables.
I do too.
But I think the bottom line is that maybe don't wait until things are completely broken down. Like don't wait till the engine is smoking and the tires are creaking and the brakes are not braking, and take yourself in to an integrative doctor sooner than later.
Yeah.
I'm not saying ignore your primary care or whoever you have, but get into an integrative, get to that head coach.
Yes.
That can then, even incorporate what you're doing with your primary care traditional physician.
Exactly.
But, look at your body as a system that needs a integrative.
Yeah,
approach.
disciplinary. Yes.
Thank you. Multidisciplinary approach.
Yes.
And care for it so that all this other talk about longevity and, living out as long as you can. Let's live the best life we can.
Exactly. You don't want to just live. You want to live.
Yes. And don't let menopause be the norm. Don't let all the negative symptoms of menopause be your norm. They say that, it is not normal to live your life in pain.
No.
So let's deal with these symptoms and deal with these issues and, fight the fight with all the tools that we have.
Exactly. And one last just pearl. And I when you're on some of these supplements and your hormones are balanced, I can tell you the feeling you're feeling is not euphoria, it's optimism. So you feel that, the glass is half full.
Yeah.
I mean, and that's what health feels like. Optimism.
Yeah. Wow. I think about, again, my whole life has been my family, my children, and giving to others. And as you're saying that, I'm realizing, why am I not using every one of these tools? And part of it is, I feel selfish. Isn't that weird?
Yes.
I know. A little bit like, that's a lot to give to me. It's like, oh, I could drop the F-bomb on that. Yes, man. What the F?
Yes.
Why? That's it was just like such a weird realization as you were saying that. I was like, God.
So
I have avoided several of the things. Like, I'll do this, I'll do that.
But not the big picture, because you still, and I mean, if you're feeling like that, but you're able to verbalize it, can you imagine how many other women feel that, but they don't know what it is? Why don't know?
It makes me want to cry, actually.
I know, it's sad.
It is.
Mm-hmm.
And it's,
It's almost like, I mean, of course, if our kids need hormones, I mean, everything. If they're in menopause.
I've got a cat that's sitting in the other room right now that potentially is going to need like $4,000 worth of surgery. And I'm like, okay, kitty cat, you're going to get your surgery. And if I were thinking about spending $4,000 on supporting my role, I'm going, well, I could do this and that. And like, maybe I'll have to spend $300 and that's it.
Maybe I'll just get my hair colored.
And I even do that myself. Naturally brunette. I can't for naturally brunette.
Oh my God.
Wow. Yeah. And ladies, don't do that.
Don't do that.
Don't do that.
Yeah.
Okay, so I'm here to help you guys learn stuff, but today I just learned a really, really big thing about me. So
that's huge.
That's kind of a big deal. Okay, with that, Katrina, I love
so much
you.
Fun.
Thank you so much. And people may not realize she and I haven't seen each other in years, and it's just, I've been so blessed. I feel like this podcast has allowed me to reach out to people that I haven't seen and say, I want to bring you in and I want to talk to you about your expertise and what you do and what makes you so amazing and special. And, I've always admired you as a woman who also raised twins. We both are twin moms.
Yes.
And, as a physician and just an all around just awesome person. And I'm very, very grateful to have you on my podcast.
Well, thank you for asking. I mean, and honestly, the next time we will stick with it. We want to educate. Look, I'm in whenever you want me back, but you are doing a great job. I think this is so important. And I think that if we can just get to the innuendos of health, and not tell everybody what they've always heard, but those little things that, the light bulb comes on,
right?
Then I think you're on the right track.
Yeah, that's what we want.
Thank you for inviting me.
Thank you for joining us. And you're going to be seeing this on YouTube and Spotify, and get on my Instagram page, Lips of Steel Podcast, and put comments in. If there's something new that you want to talk about, something that you haven't heard about, you have questions about, send a message, put it in the comments on the podcast video. I read every one of them, and I will bring guests on to address some of the issues that you may or may not have heard anybody talk about before. So thank you for joining, and this is Lips of Steel. My name is Nicole Radoumis. Thank you for joining.